Hello, and welcome to Community Voices, where we talk to Humboldt County's movers and shakers. Paul's guest today is John Gullam from the Northern California Community Blood Bank. And now here's your host, Paul Bressoud.
Hello and welcome to Access Humboldt's Community Voices. I'm your host, Paul Bressoud. Today we're going to be speaking with John Gullam from the Northern California Community Blood Bank. And welcome, John.
Thank you very much. Glad to be here.
Yes, great to have you. As I was reading the information about you, I saw just in your title, it said director, and then under that directorship, it said donor resources. And so my first question is, what are donor resources?
Well, we are whatever our donors need. Communication, marketing, scheduling donors, donor recruitment. Our main function is donor recruitment and outreach. We recognize that part of asking people to donate is educating the community about the need for blood, what a donation looks like, why we need blood.
Let's start with that, educating the public about the need for blood. Could you go over that? And then we'll talk about it specific to the uncertain times that we're in.
Absolutely. First, we all have and need blood, and there is no artificial substitute. A number of years ago, the Armed Services Working Group on Artificial Blood disbanded because they were getting together once a year and deciding nothing had changed. It wasn't going anywhere. There may be solutions in the future that eliminate the need for temperature controlling blood components. We're actually working with a company that's working on a way to freeze dry platelets so that they can be used. The first use would obviously be on the battlefield. Typically, some rescue helicopters will carry blood components. Some ambulances will carry blood components, but they all have to be liquid and temperature controlled. And so people have been looking for some kind of non-human replacement, and it's not going to happen. It's not going to happen in our lifetimes. Our blood is so complex that the attempts at making it artificially have all failed. What people are working on are specific functions of different blood components and whether there are other ways to address those issues.
So first and foremost, without any sort of, way that blood could be made, except the old-fashioned way, just the human way, then it is always your job to continually be asking for blood from a community.
Absolutely. And we have the word bank in our name, but I tend to think of us more like a grocer. Because all blood components have a shelf life. We can't take a blood donation and put it in the vault and leave it there for 10 years and then use it. The three main components of human blood are platelets, plasma, and red blood cells. They each have a different function, and they can each be stored for a different period of time. Plasma is the bulk of your blood. It's mostly water and has some key proteins that aid in clotting. It can be frozen for up to a year. Red blood cells carry the oxygen to your body, and they can't be frozen and must be used within about 56 days. Platelets, which are the primary clotting factor in your blood, can't be frozen, and they're good for 5 days.
Now you got me confused for sure.
Yes.
So you take a pint from me, okay?
Correct.
That has a 5-day shelf life if you just want to use the whole thing?
Nobody uses whole blood. It's been quite a while since a whole unit of blood was transfused. because the different components have different functions, typically a patient will receive one or more of the components, but very, very rarely in the same ratio that they exist in the human body. There's actually been a plateau in the need for red blood cells, mostly because of improvements in surgeries, ways of using less blood during surgery. Platelets, again, they're the key clotting factor, and there are new uses being discovered all the time for platelets. When you donate a pint of whole blood, there are a few milliliters of platelets in there. So primarily what we do to get platelets is a process called apheresis, where while you're in the chair, your whole blood goes into a machine where it's centrifuged. The three main components have different specific gravities, so they separate. We'll keep whichever component is most appropriate, usually the platelets, and then you'll receive the other components and possibly some saline back. And what that does is allow us to manage the supply to more closely meet the demand.
John, does this make it harder or easier for the blood bank to have blood on hand? Or the components of blood on hand?
It allows us to more accurately recruit and collect for the need. If we were getting platelets from whole blood, we would need a huge volume of red cells and plasma that wouldn't be needed in order to get the platelets that were needed. So the apheresis process allows us to target the component we most need. Now, you can be in the chair for up to an hour and a half doing apheresis. So Wow. It's a very different ask than having somebody donate whole blood. You can be in and out of the blood bank in 45 minutes to an hour donating whole blood. I think of it as a very different mindset for donating platelets. Folks can be in and out during a longish lunch to donate whole blood. For platelets, I tend to think of it as half a day. If you're going to donate platelets in the morning, probably plan on going to work after lunch, or vice versa. Go to work in the morning, come donate. We have a lot of very dedicated retired donors who are here during the day. And we'd love to see more of those folks and give the folks that are donating so frequently a little bit of a break.
Well, let's talk about that very issue. That's fascinating because you bring up two important points, I think, for right now, and that is for people to want to go out and be hooked up or whatnot for an hour and a half in a chair and X amount of more time traveling. And then the second thing would be, you talked about retirees, and yet retirees seem to me to be in the most at-risk age group. So getting people in the most at-risk age group to go out for the longest amount of time, that's not what I would call the win-win right now.
No, it's definitely a challenge. And we definitely have longtime donors who've said, I'll see you when this is over. And we absolutely recognize that and know that we won't be seeing them till whenever, maybe the middle of next year, maybe late next year. But one of the things that we're really emphasizing is that we're a place full of healthy people. We have a whole questionnaire that goes through all of the possible illnesses a person could have. And so blood donors tend to be healthy. We're also a medical facility. We know how to keep things clean. All of our staff are wearing masks.
Are they tested?
No, not unless there's a possible exposure. We do have a flow chart about what we do in different cases. If someone who has come in to donate reports contact with someone who may be positive, so now we're 2 steps away, and a third step, our staff will then isolate for 10 to 14 days, depending on which release you're looking at and which regulatory agency has just issued something. Obviously, things are changing day by day, and
Right.
we're
It's a
we're
civics
meeting.
lesson, believe me.
Yeah, we're meeting 3 and 4 times a week as a management team to talk about policy changes and
Oh.
changing signs and what the next most appropriate step is going to be.
Well, let me go back to this because to help me understand. So we're talking about the retirees. We're talking about the special procedure about the platelets, the one that takes the longest.
Right.
And then I would assume retirees are also probably the number one donors for all aspects of the blood bank. And that being said, how much less are you taking in right now just from that group?
Well, it's an interesting demographic problem. I told people we have demographically the same issue as Social Security. All of the baby boomers who used to pay into Social Security and are now getting ready to take out used to be active young blood donors, and they're beginning to get to the age, and that's a huge population bump,
Right.
that are getting to the age where they're more likely to be on medications. They might be traveling. They might, and so yes, we'll be losing that group of baby boomers and need to backfill with younger folks. I've been very encouraged by the young people we see. We haven't been to high schools this year, but high school.
That's a large percent of your intake, correct? Because
Absolutely.
I taught at Eureka High School for 30 years. The Eureka High School blood drives were very successful events.
Absolutely.
I think one year I had the fastest pint going out. That was, and the fastest pint going in, but not on the job. But they were well-supported events by the student government and whatnot. Were other high schools doing that?
Yeah, absolutely. In fact, up until this year, about 25% of our whole blood collections came from campuses. Between the high schools, HSU, CR, those were both huge providers for us, and we haven't had that this year. What we have had is almost 3 times as many individuals coming into the blood center as have in the past. As an industry, blood banks have been working at getting to where the people are. There's been a huge focus on making blood donation as convenient as possible. So we have 3 blood mobiles. We've been out in the community. We've been doing blood drives. One of the things that really made us feel great about how people in this community see us and see the ability to help their community is that when COVID first started, we had a huge spike in donations. We had a huge spike in first-time donors, folks who hadn't been in a number of years, folks who wanted to do something to help, and were more comfortable here at the blood center. That has kind of continued. We're still collecting more units in-house than we are on the blood mobiles, which hasn't happened in quite a few years.
Now, that would seem to me because maybe people are more comfortable with the amount of space that they can have in the center as opposed to a blood mobile.
Right. We are doing social distancing on the blood mobiles and in-house. On the blood mobiles, we have established numbers of people, donors, and staff for each blood mobile based on their size. But yes, the blood center is much larger than a blood mobile. So, and even there in our welcome center, 4 donors at a time are allowed in there. There are days that we've had days in the past where we've had 12 or 15 people in there waiting to donate on big donation days. And now we're limiting that to 4 people. In order to keep the social distancing. We're taking temperatures as they come in the door. We're doing some pre-screening in terms of signs with information about interaction with people who might be COVID risks. And so we've always hated the idea of pre-screening. We want folks in our system so that we can keep track of previous illnesses, issues that might defer them. If somebody comes up to the Bloodmobile or the blood center now, there's a big sign that says, in the last 28 days, have you, and a list of things. Folks might turn around and leave because they've answered yes to one of those questions. There's a whole questionnaire that they've then skipped. There might be something on the questionnaire that would keep them from ever donating, but they're not going to know that because they didn't do that step. So things have definitely changed. We're asking for patience from our donors, and we're definitely getting it.
When people sign up to come to the blood center, are they making prearranged appointments?
We have actually just introduced appointments for in-house donations here at our center. And there's a link on our website at nccbb.org.
Excellent website. It has very up-to-date COVID-19 information. People can touch that top link. I read it. I was quite impressed with that.
Thank you.
I just wanted to throw that in. I did use it before I came to meet you.
Thank you. Yeah. So we're doing in-house appointments now, which walk-ins will always be welcome. But it absolutely helps us to space donations out during the day. And we've always had and will always have ups and downs throughout the day. When 4 people show up at the same time, that's just a coincidence. But if they were to show up every 15 minutes, it would be that much smoother and quicker. So we're encouraging the appointments. We do have a software upgrade due out next year that hopefully will allow us to take appointments on our mobiles. Right now, it's just so complicated with 3 Bloodmobiles being in different places every day. We haven't found a system that works for us, but the new software upgrade should allow us to do that, which will also let people get us into their book, get us onto their calendar with a little bit more firm commitment than, oh yeah, I should donate. So when folks have an appointment, I think we're going to be more likely to see them, and it's kind of a built-in reminder. But we also do telephone recruitment. We call folks the night before a blood drive to let them know that they're eligible, and we target that calling based on daily blood type needs, along with the 3 main components.
These are people that are already in your records, though, correct?
Correct. So that person who walked up and saw the sign and had to turn around and leave, unfortunately, we're not going to be calling them back because they're not in our system. So that's an opportunity that's lost at the moment.
Now, I would assume that there's a minimum, whatever you measure the unit in, amount of blood that the county would have to have for a safe level. But are there also, there must be minimum amounts of blood types. And do you ever have sort of a shortage or a crisis almost in a type of blood?
I'm sorry, I was grabbing today's inventory. There are 8 blood types, O positive, O negative, et cetera, et cetera. O negative is the universal blood type. Anyone can receive O negative blood. In a trauma situation, until the hospital knows the patient's blood type, they get O negative. O negative donors make up 6% of the population. In a typical year,
6%?
Yes, 13% of the blood we send to the hospitals is O negative. So when people say, I'm O negative, and they're constantly calling, yep, we need those folks twice as often as other types. At the moment, we've been low on type A positive and A negative. Who knows why? It varies every day. And to your question about quantities, we work on a 10-day inventory. But again, that's numbers. And average means you're wrong half the time and wrong half the time. So we work on a 10-day inventory, but a bad trauma can use that 10-day inventory. The 10-day inventory is what gets used in an average 10-day stretch. But a bad automobile accident can go through that very quickly. So what our goal is to ensure that we have enough on hand to meet the needs of that incident, and then we're going to be on the phones trying to backfill that. And so one of the messages we try to get out to folks is donate today, because we don't know when the next biggest blood usage day of the year is going to be.
This fascinates me. Do you come to work in the morning? Here you are, the director of the donor resources. And do you have any sort of information that will tell you that there was some sort of trauma that's going to create a demand and a need for blood, and that goes ahead and triggers how you go ahead and recruit people or try to backfill, as you're saying?
Our distribution department gets an inventory from all of our local hospitals every morning, and we go over that inventory at an 8:45 stand-up meeting. So every morning at 8:45, representatives of every department in the organization come together to talk about what the day is going to look like.
Wow.
So if there was a trauma overnight, we know we need to focus on a certain blood type. And with the different components and the platelets and the plasma, all of our testing is done at a lab in Seattle. There are only about 6 labs left in the country that do all of the kinds of testing that a blood center needs. So every afternoon, a courier is taking test tubes to the airport to be flown to Seattle to get test results that we'll have available the next day. If you've ever tried to catch a flight out of Humboldt County, you know how problematic that can be. Between FedEx, United Airlines, and private couriers, our distribution staff is constantly on the phone finding out when flights are going to change. We serve Sutter Coast Hospital in Crescent City. We serve Gerald Phelps in Garberville. We have stat runs where someone needs to hop in a car with a blood component and drive to Garberville or drive to Crescent City. One of the things I love about this job is that we have high school students who come in the evening, work for 2.5, 3 hours, calling folks to let them know they're eligible to donate, generally work 10 to 15 hours a week. We have clinical laboratory scientists and everybody in between. Excuse me. It is an awesome organization full of people who love to come to work every day and feel good going home every night. So, sometimes it's a job and the person next to you is getting on your nerves, but at the end of the day, it feels great to be able to do something this important for the community. And we get to work with the most generous people in the world. The people that come here to donate blood, statistically, they're also voters. They're probably out on the beach picking up trash. They're
citizens.
They are.
They are citizens.
Yes.
Decent citizens.
Yes. And we love seeing them every day.
Historically, a question to end on, I'd like to ask a historical question. And that is, I don't know if you were working when the blood business went through the AIDS crisis. And I would imagine, obviously there's still safeguards in place from that.
Absolutely.
And now the COVID crisis, how is it? How fast are people in the blood business thinking on their feet? You said you were changing policy all the time and figuring this out and able to offer safety for people to donate blood.
It is ongoing. We have a quality assurance department who gets emails from America's Blood Centers, the American Association of Blood Centers, the FDA. We're regulated by everybody that a regular business is, Cal OSHA, all of the regulatory agencies, plus all of the blood-centered compliance organizations and agencies. And like you say, with COVID, things are changing constantly, whether it's what our employees do because they're coming to a job or what they're doing because of the type of work they're doing. Things are constantly changing, and we need to go through all of these regulations and figure out. Typically, it's the most restrictive regulation that we have to follow. But if OSHA comes out with something, but the feds come out with something different, and the CDC says you should do this, we have to figure out which part of which we need to be doing. And like you say, we need to be thinking on our feet to make sure that we're meeting the needs of our local community, because at the end of the day, that's why we're here.
Well, that's fantastic. Thank you so much for being on Community Voices today. People can go to the website. They can make these appointments to go in. Thank you so much for the work you do at the Northern California Community Blood Bank. Have a good day, John, and a happy holiday, huh?
Thank you. You too, Paul. Have a great day.
This has been Community Voices with your host, Paul Bressoud. Thank you for joining us. If you represent a nonprofit organization and are interested in being a guest on Community Voices, send an email to info@accesshumboldt.net or call 476-1798. Access Humboldt, local voices through community media.